Here at the Durham VA healthcare system, you and I get to work with people who are committed to improving the health and well-being of America's veterans every single day. We also play an important role in training the healthcare teams of the future. Our employees and trainees embrace the I-CARE values of integrity, commitment, advocacy, respect, and excellence. We work together to ensure every veteran understands that we care. We strive to create a safe environment where veterans and their loved ones, our staff and trainees, all know they are valued and that they belong here. Unfortunately, we know that sexual, racial, gender-based, and other forms of harassment or inappropriate comments happen in healthcare settings. The leadership team at the Durham VA wants you to know that harassment of any type is not tolerated here, and we want to share a few practical strategies you can use if you experience or witness harassment or inappropriate comments in your workplace. To begin, I'd like to ask Dr. Legoo, our Chief of Surgery, to share a scenario.
Thank you, Dr. Emler. While this scenario is not an actual case involving a specific veteran or trainee, it is similar to actual scenarios others and I here at the Durham VA have witnessed or personally experienced. Imagine you're taking care of a 75-year-old male veteran. He is sick and alone and in the hospital for complications related to his service-connected illness. He hasn't been able to sleep and is afraid he will lose another toe or worse, his foot. His wife cannot travel to visit him and his children are estranged. When the team walks in to see him in the morning, he complains about the fact that it's another new team. He pointedly looks at the one Caucasian male on the team, who happens to be the second-year resident, and says that he does not want any ethnic doctors or students taking care of him. On this team, the third-year resident and the attending physician are both young females, and one wears a hijab.
Thank you, Dr. Legoo. How should the team handle this? How do we honor our veterans, keeping them at the center of all we do when faced with mistreatment? Veterans have a right to refuse care, but no one has the right to harass. When working with this veteran, as clinicians, we must avoid unproductive labels such as sexist or racist patient, and work to understand and respond appropriately to problematic behavior. ARRACE is an acronym which may help teams navigate some incidents of harassment.
As we know, sexually and racially inappropriate comments and harassment are well documented in medical settings. Female healthcare professionals, physicians of color, and trainees report higher rates of these behaviors. A team at Yale School of Medicine developed a helpful acronym for this, ARRACE. The first E stands for expect. Unfortunately, this kind of response is not unique or even rare. The team should expect this and be prepared with a response of their own. Practicing can make it easier in the tense moments of a confrontation. R is for recognize. In the scenario that Dr. Legoo outlined, there is clear evidence of bias. Other situations may be more subtle, but it's important to take a moment to check in with yourself to determine if the situation feels innocent or, as in this case, out of line. You can ask clarifying questions. I'm not following you. Could you help me understand what you mean? It's also important to recognize your own response to the situation and to ask yourself clarifying questions about your own reactions. Next, you should address the mistreatment with a script you can use readily in these situations, one that feels natural to you. Respond in a way that sets boundaries in the moment, addressing the behavior, and moving on to the task at hand. We are your healthcare team. We all have medical degrees and are here to provide you with excellent healthcare. Then move on. It's best to avoid apologizing, arguments, or negotiations here. Always use your best judgment and remember that the veteran has the right to refuse care. S stands for support. After the event, check in with each other. You can say, "That was challenging. How are you feeling?" Seeking assistance from your supervisor or from human resources are also options available to all employees. The final E stands for establish and encourage. Encourage means being a good, active listener. There's a remarkable healing power in listening and helping people who experience harassment feel validated and heard. Establish means exploring options to resolve the situation. If you're interested in playing a part in the efforts of our Safe Culture Committee, led by the Chaplain Service, please reach out to us.
Thank you, Dr. John Alagata. ERASE is a helpful method which can be used when staff or learners are mistreated by patients. But what should you do if you witness harassment between veterans? Or if you're concerned that a staff member may be making a veteran uncomfortable in a similar way? Dr. Leinbach is here to share a strategy taught at Duke University on what you can do if you're a bystander.
Have you ever witnessed an interaction between two people which seemed inappropriate or even hostile? The VA's Prevention and Management of Disruptive Behavior training helps with de-escalation techniques. Another quick and easy way to respond is to remember the 4 Ds. The first D stands for distract. If you are witnessing unwelcome behavior firsthand, one way to handle the situation is to distract. Interrupt by starting a conversation about something entirely different with the person who was targeted. The second D is for being direct. You could point out, in a way that is inclusive, that we don't say things like that at the Durham VA. In the scenario Dr. Legou described, you could ask directly, what do you mean by that when you say ethnic? Another way of being direct is to appeal to values. Sir, I'm surprised by your comment because I know you to be a respected and respectful member of society. The third D is for delegate. Ask someone else to help and share information about helpful resources here at the Durham VA, including supervisors, our EEO office, the patient event or disruptive behavior reporting sites, as well as VA police. The final D stands for delay. If you don't personally witness it, but hear about it after the fact, check in with the targeted person afterward to see how they are doing.
There is no one right way to address mistreatment, sexual or racial harassment in the healthcare setting. But the methods we've discussed in this video can be helpful.
Together, if we see behaviors that are inappropriate, we can call it out using ERASE. Expect the behavior. Recognize it for what it is. Address it with a different response. Support the targeted person, be it a fellow employee, trainee, or veteran, and encourage and do your part to establish a better culture.
We can also use any one of the 4 Ds if we are standing by when these behaviors occur. Distract, be direct, delegate, or delay. It is never wrong to report concerns to supervisors, labor relations in HR, an EEO representative, or even the police when appropriate.
You can enter a patient event report through the Joint Patient Safety Reporting System or a disruptive behavior report. And if you're interested, please consider working with our Safe Culture Committee. We are all part of the solution.
Thank you for choosing to work at the Durham VA healthcare system and for doing your part to promote a safe, inclusive culture where all are valued as part of the team which honors our veterans by providing them with safe, world-class healthcare.